Pain on your right-hand side can occur for different reasons. These may be related to problems with your kidneys, appendix, or pancreas, but also it could be the result of bone problems with your ribs or hips. The first thing to do is visit a doctor for an examination and rule out any serious problems. Pain on the right-hand side is one of the most urgently attended conditions, and it can also be accompanied by other symptoms such as dizziness, nausea, vomiting, constipation, diarrhea, loss of appetite, gas, fever. Possible causes of pain in the right-hand side. 1. Bone injuries. This is one of the main causes of side pain around the rib cage. Injuries this area are very painful, and it can particularly painful to breathe as the rib cage expands. It can also take some time to heal. Pneumonia. Pneumonia is a possible cause, although it's much less common. Pain is a sharp, stabbing pain and gets worse when breathing deeply or coughing. This condition is also accompanied by symptoms like coughs, yellow mucus, fever, shivering, and difficulty breathing. 3. Gallstones. Pain on the right-hand side could be due to problems with your gallbladder, such as gallstones. A patient with gallstones will have a slightly yellow coloration to the skin, a fever, pain the upper right-hand side or the middle of the abdomen. 4. Gas. Often, the most common cause is indigestion or due to constipation. 5. Appendicitis. This is inflammation of the appendix, the most common cause of pain in the lower part of the right-hand side of the abdomen. It can happen to people of all ages, but it's more common between the ages of 10 and 30 years old. The symptoms can begin with a pain in the belly or in the upper abdomen, which then moves to the lower right-hand side. Touching this area will cause a sharp pain. It's possible that you may experience nausea, vomiting, loss of appetite, or diarrhea, in which case you must go to the hospital immediately. 6. Pancreatitis. The pancreas is found below the liver and behind the stomach. Medical conditions such as pancreatic cancer of pancreatitis can cause pain in the upper part of the right-hand side. 7. Abdominal hernia. Operations on abdominal hernias are very common and are undertaken to avoid a strangulated hernia. Because of its position, the hernia can cause abdominal pain in the right-hand side and the area will be painful to touch. It can also cause nausea or frequent vomiting. 8. Kidney problems. Bladder infections or infections in any other part of the urinary tract can extend to the kidneys and cause inflammation and pain. This pain is an abdominal pain beneath the right-hand side of the abdomen, which later can spread to the back. 9. Colon issues. The upper colon is found on the right-hand side of the abdomen, and it's the final part of the digestive tract. It's probable that it can cause pain as a result of intestinal inflammation, such as colitis, irritable bowel syndrome, or Crohn's disease. 10. Ovarian cysts. Cysts are small structures that can be found on the surface or inside an ovary. If they are large or rupture, they can cause pain. Remember not to ignore any discomfort. When faced with any symptom, go to your doctor for appropriate treatment. Taking care of yourself and staying in good health is totally your responsibility. Diagnosis. In order to carry out a correct diagnosis, doctors check 3 things in order to find out the source of the pain. How long have you experienced the pain? What other symptoms are you suffering from? What does the patient attribute the pain to? If the pain is in the area of the ribs, it'll be necessary to see if you have a cough, a fever, suffered an injury to that area, if you're short of breath, or if you have any skin injuries. The patient can apply a gentle heat to the area, and if the pain is not too intense, then in the majority of cases this will be enough to soothe it. Pain the area below the stomach on the right-hand side can be related to allergies or intestinal inflammation. The most appropriate treatment for this problem entirely depends on the root cause. If the problem is because of a muscle spasm, the best course of is rest and physiotherapy. If the problem is a kidney infection, it may be best to take antibiotics, and in the case of appendicitis, surgery will be needed. The most important things is that, if you have any questions or symptoms, you must consult your doctor for diagnosis and your peace of mind. 7 things you can do to get rid of lower back pain. Although physical exercise is usually good for improving lower back pain, if we see that it does not subside or that it worsens, we should avoid it and consult a specialist. Read more.